All right, skilled nursing. We'll get through this because this is the second part. So observation. Everybody kind of got yeah.
I'm looking at number 2 bullet. The only qualifying part for that is a 3-day stay. What if they're not skillable? And that happens a lot.
Now hold up. Yeah, that's true. Where did you say you work? Where did you tell me you work? All right, that's a good point. So I'll mention that. All right, so we got observation. You got it. Just because you're in a bed doesn't mean you're an inpatient. You kind of got the and this little brochure that's here. The reason Medicare puts this out, and you guys will have it. There's a lot of situations there too. So when you leave, take a look at those because let's say if you come in with this and this happens, what are you going to be? And if it gives you some situations. So it's got chest pain and it's got you stay overnight, and it's got some good little situations there. And it also has a couple for your SNF coverage. Now, this same principle. It's all what Medicare will cover. Okay, so like your Advantage plan, they're only going to cover whatever when you sign your plan, you look at it and they go, okay, well, you signed up, you get, 15, 16, 20 days SNF coverage at whatever. It specifically tells you what you can qualify for. Medicare's the same way. This isn't the greatest rule. So many people in healthcare hate this rule. I tell you, for the last probably 8 years, there's been bills in the United States Senate and House of Representatives to do away with this. It just isn't gotten there. But this isn't really. No one really likes this rule. But guess what? You can't get around it. It's federal law, right? So lots of folks are trying to change it, but it's Medicare. So it's difficult to change. And in budget crunch times, this may not get fixed for a while. You never know. But here's what Medicare says. For them to pay for your skilled nursing coverage, traditional Medicare, maybe not your Advantage plan, but traditional Medicare, right? You got to be in the hospital as an inpatient, not observation, as an inpatient, right? For 3 midnights. Now, that 3 midnights that makes you think, right? You can't be here and leave on the 3rd day. They won't cover it. You got to literally go midnight. That's you come in at 11 o'clock at night. Midnight. That's one night. Even if it's right before midnight, and then 2 nights and 3 nights. It's just it's just the Medicare rules. That's just how it is, right? It's like how we pay our taxes. You just got to fill out a 1040A or whatever. So 3 midnights. So you come in, you're an inpatient today. You get admitted right now. Heart attack. But it's not a bad one. You stay a midnight, you stay another midnight, you're ready to be discharged on the 3rd. Medicare's not going to cover your skilled facility. Right? You gotta be really Medicare. What Medicare has tried to do here is say, you gotta be really sick. I mean, at least for 3 days. No UTIs, no just hanging out after whatever. You gotta be sick and needing things for 3 days for us to pay for your skilled care. But at least has to be 3. So back to your point, his point that he made earlier. Your observation for 2 days. They finally figure it out. You've been getting treated. They make you an inpatient, but in a day and a half you're ready to go home. Now you've been in a bed for a total of 4 days, but you've only been an inpatient for a day and a half. Guess what? Medicare does not cover your stay. This is where these patients typically that you see on Brian Williams. Well, I was there for 4 days. Yeah, but the first 2, they were trying to figure out what was wrong with you. You weren't an inpatient.
Even though it's going to bill as inpatient.
Yeah, it's going to bill as inpatient, right? 4-day stay. It's going to bill as inpatient, but Medicare's not going to cover your stay because you are only an inpatient for 2 days, 2 midnights. It's just the rules. It's the Medicare rules. Now, here's the kicker. What has to happen and how you keep this happening is your case management department, my folks, are out there saying, look, I know you've been here for 4 days, but you haven't been here for 4 inpatient days or 3 inpatient days. So we need to look at home health, and we need to look at something else, or you're going to be paying for this on your own. See, and you got to have that. But you can protect yourself by knowing that. Okay? Yeah.
Or by refusing to leave for a day?
That won't work. That won't work. That's a great idea, but it doesn't work. Because believe me, in these Medicare guidelines, they say, and Medicare hires contractors to do their billing, right? It's not like Medicare is just in Washington somewhere and sitting there and doing it. No, they hire people to do everything. They hire people to do all their claims. So you've got, with all your insurances, you get your envelope from your claims, and it comes from South Carolina or Texas or wherever the claims administrators are. Medicare's the same way. They hire claims administrators in different regions all across the United States. Yours is First Coast. It's right here. Okay? So they hired this group to make sure these things are done right. They look at this specifically. They look to see inpatient, and if you left at day 3, they're going to automatically review that claim to make sure and ask for those records to make sure all those days were appropriate, that you just weren't hanging out waiting.
So I go in, I'm observed for a day and a half, I'm inpatient for a day and a half. NCH will bill me as inpatient for 3 days.
You can,
Correct?
yeah, you're going to get that whole stay is going to be an inpatient.
So the bill may not reflect may not in reality reflect what was in the chart, because the chart says outpatient.
Right.
Okay.
But now think about that, because what CMS is saying is, well, you did the work and you did this and you finally figured it out in your 3 days. That's why these congressmen forever are fighting to get rid of this. It doesn't make a lot of sense, but it's the rules. Okay, so you can't fight it. I'm gonna tell you, I haven't seen one individual beat Medicare. Huh? Not one. Not one. Lose houses, lose everything. It's not going to work. Spend money, and hang it up. Possible, but I haven't seen it. You gotta protect yourself. You gotta know the rules, and our department is going to be protecting you in the same way. We're going to be coming in there going, "Ooh, I know you've been here for 4 days, but that's not a qualifying stay." Okay, we got to look at something else here.
So first of all, thank you for being here, and when we have problems, it is refreshing to have you there in your position at the hospital, and I hope you are enjoying Naples and will stay for a while.
Oh yeah.
In that case where we have a person who is on Medicare and we know that this person needs to go to rehab, a rehab stay is expected. It is a reasonable expectation that your caseworkers are going to help the patient with that process. And let's say it was this observation for 2 days and transitioning over to inpatient. It's also reasonable for your caseworkers to be aware of that and to be telling the families along the way, "Oh, I know you want a rehab stay, but you've only been in the hospital 2 days." So this shouldn't come as a surprise to any patients or families. The caseworker you would expect your caseworkers to be on top of that and communicating that with the families.
Exactly.
Okay.
Yep.
Do you have any special remarks to make about veterans?
As far as I'm a veteran, so this one. But as far as what, like?
Do you get special treatment, special prices?
Not that I'm aware of. So I don't think there's any. Currently, there's not any. Because the VA, depending on your, the VA's got you got so many categories that you fit in. Depending on your categories, depending on what you qualify for, but we got lots of VA folks that come from the VA here. Probably will be getting more since they have passed the law to let veterans actually seek different care. So yeah, yeah.
How does long-term care insurance fit into this?
Well, long-term care insurance, and you got to know what you've got because there's so many different policies out there. They'll pay from everything from your skilled care to assisted living to home care to medicines. I've ran across long-term care plans that actually pay for medications, believe it or not. They're usually based on units, so you're buying 60 or 70 or 80 units, and it goes kind of fast. Typically, they'll cover a couple of years in a facility, but they will cover your skilled nursing, but typically it's not skilled nursing, but typically it's custodial care. So typically what you think of nursing home type care. That's usually, or care in your home. But when you use care in your home, the typical one eats your benefit up a lot faster than if you went to a nursing home. There's lots of different ones. They're getting very expensive. Custodial care, $6,000 a month probably in this area, so it's expensive. Yeah. Mm-hmm.
Question, when you're talking about case manager, is that the same thing as social worker?
Yep, they're a little bit different, but
Because
pretty much
we
do
did
the same
have-
thing.
My mom was in the hospital not too long ago. She did have a person that spoke to her 2 or 3 times, and she called herself a social worker.
Yep, I've got both, and got case managers and social workers. It's just their background and their, what education they have, but pretty much they do the same jobs. A little bit different, yeah.
Okay, thank you.
Oh, it's okay.
You've been wonderfully
Oh,
clear, and I really
sure.
appreciate it. My concern is that when I'm sitting in the hospital room, I'm not quite as clear thinking as I am at this moment. Are they going to be as patient with us as you are?
I would hope so. I definitely would hope so. I can tell you that my folks here at NCH are this is what we do every day, and we are charged with taking care of you. It benefits you and it benefits us to do it right. So that we are there. We're there. We're giving those pamphlets, and if you guys come in and you don't get something or it doesn't make sense, ask for that case manager. And if you don't get satisfaction there, and I think you will, then you can ask for me and we'll talk.